viewers, this is Fact Hangout coming to you from the studios of CRVSR TV. Now, CRVSR stands for Campaign for Restoration of Values and Societal Reformation. It is an NGO organization that has taken the responsibility to restore sanity and good values to our community. I am by name Olashubo. I am going to pilot today's show just as I have been doing it subsequently. But today I have with me in our studios Mr. Yahya Itopa Musa. You are welcome, sir.
Thank you.
And Mr. Yahya Itopa Musa happens to be a nurse by profession, a clinician, and a nurse educator. He works in a private firm in an hospital called the Real Admirable Hospital, Ikeja. And today we are going to be speaking about the Nigerian health sector, why we concentrate majorly about the ravaging coronavirus pandemic. You're welcome once again, sir.
My goodness.
To start with, looking at the whole world now, despite the fact that we have coronavirus pandemic that has hit the waves of everything from education to technology to health to finance. In fact, we just had that few weeks ago the oil price dropped.
Yeah.
Now, the coronavirus pandemic, we all know that it is the medical sectors, they are the frontliners. They are the ones facing the virus head on. Now, can you tell us how the importance, the role of the health sector in the fight against this pandemic?
Well, thank you for the audience granting me to talk on these actually influential topics. So, regarding the roles of the health professionals in the fight against COVID-19, I think it's very, very versatile that we cannot use few minutes to talk or discuss here.
Yeah.
So we're fortunate to know there are a lot of factors that are required for health sectors to function optimally, which I can tell you crystal clear is that the governments are not doing well.
Okay.
As far as our roles as a clinicians and the roles of a colleagues who are there, we are there to receive a patient, be it malaria, typhoid, and what have you, and so related. We have tuberculosis, we have pneumonias. These are cases that are similar, that are showing the same symptoms or present themselves in the same similar symptoms with COVID-19. Yes, but in norms, a country who are prepared for so many cases, scenarios, or case findings or outbreaks, we shouldn't be running hectare-scatters when it comes to the issue of COVID-19. Our roles have been undermined by the government. Looking at the COVID-19 you were talking about, on a norms, is a disease condition. There should nothing to be forgetting about. That I can tell you, we in the health sectors, we are now forgetting because we are not prepared, we are not equipped. You know what we mean by equipped? There is no equipment, like PPE we were talking about. On a norm, yes. On a norm,
That is personal protective equipment.
Personal protective equipment. So, on a norms, when a patient is coming, you don't know what this patient is coming in with. The patient, you must receive the patient. If you are exposed and the patient happens to be a positive patient, so your life is not safe, it's at stake. But the governments, like I made mention of, that we are being undermined for not protecting us. So the government has exposed us unduly. Like as of 3 days ago, we had about 144 health workers that have been exposed. Few of them have been tested. Some are still in isolation. So our roles, we are playing it skeletally right away. I tell you skeletally because on the norms, we should have all the units functioning optimally. It's only isolation that is functioning now.
The isolation centers.
Isolation centers are the one functioning optimally. They are the only ones that have this gadget we're talking about. People's in the A&E, Accident and Emergency Center, be it medicals or accidents, people, you don't know what people are coming in with. COVID-19 do not write on the face.
Exactly.
Some are asymptomatic.
Yes. They don't show the
Some
symptoms.
it do not show symptoms, but some are symptomatically. So before you know, even the symptoms we are talking about here, some could be TB, some could be pneumonia, some could be asthma. You are coughing, your body, you are running temperatures. Those are cases that, those are symptoms that are similar to what we have in our country before. Even a common malaria that is killing our people. So as a result of this, the governments are not helping the health sectors. So I think that is an areas that I must blame our government on. We were ready to work, but nobody is ready to die, especially when you see that the government lack that political will to help the profession.
Now
So
a quick one, Mr. Itopa.
Yeah.
From what you just said, I concluded that you are saying that the government has not done enough in providing some PPEs or medical equipment.
Exactly.
But since I am thinking that since this pandemic, according to the World Health Organization, is ravaging the whole world generally, so it means the demand and supply for these medical equipment are going to be on the high side.
Definitely.
Which means all nations that has been affected by this disease would want to would try to get their own.
Yeah.
So what do you have to say to that? Because it is a global
it's a global issue. It's a global crisis. That a country who has blessed as Nigeria shouldn't be in a crisis of. This PPE we're talking about is something we can produce within our own terrain, yes. But the governments are not helping the indigenous industry or indigenous organizations. This face mask we are using now is an imported one.
Yes.
You see people who are using clothes and
Ankara
all those things like
ones.
Ankaras and all those are
Different
improvised.
materials.
Yes. Fine. If governments can approve this, why can't the government approve PPE to produce in Nigeria? We have a lot of industry who have been calling on government to support them financially so that they can.
Sorry for cutting. I think Innocent Motors recently offered help to produce ventilators.
He has been writing several memos. He has been even on media crying that they can do it. They have the manpower. They have a lot of things. They just need a little government to carry that. Yes, assistance to carry out the necessary action. So that is why I will continue to blame the government. And why we have this. Nigeria should not be comparing themselves with Germany in terms of equipment. I can tell you that if we harness what we have here, we are more than all those developed world we are talking about, or you are hearing about. Yeah. We have a lot of things here that within us, it's enough for us. So I think that is areas the government must stand to face the reality on ground. If we continue to look at the developed world, the way they are doing, every nation has their own peculiarities that I used to say. When you mean peculiarities, what we are using, what can work for us here, might not work in Germany, might not work in Russia, might not work in US. Then, why can't the government look at? We have even our traditional research centers that is being approved.
Herbalists.
Yes, we don't call them herbalists. Traditional.
Herbalists.
Yes, herbal made. But it has to undergo through some process so that the efficacy of the drugs can be identified. All those can be done
just
in Nigeria.
Just like the case of Madagascar.
Thank you. Like what they are doing now. Are they not an African country?
Of course.
Yes, these are countries we are modern. A country of over 200 million are still crying foul, begging people, begging the developed world that they need ventilators. Take a look at, when you look at all those several isolation we had, I can tell you that if in any isolation they are using ventilator for anybody, it's just 1 in 10 or 1 in 20. Why can't Nigeria look at what can work for us here? Why can't the government of the day? Yes, we don't, because Americans are using ventilator, is working for them. Do not mean we should rely on that. That is where our government is very, very faulty. That the society need to be blaming the government so that they can stand and respond to their task. So that I can say that the relationship, there are bad relationship we have with our government. That yes, I say so. It's just like what's it called? It's just like a slave-servant relationship. The government, yes, many people have been calling anyway. We are the one that vote them there. We've been saying, let us look into our own traditional medicine. What we can have from there, what we can achieve from there. But the governments are giving us a deaf ear. So the relationships are not cordial when it comes to issue of crisis management. So I think the government need to give the society or her citizen the listening ear so that things can work perfectly. Like the way so many people are calling, has it been the government are ready to listen? One or two will have worked for us. So that is it.
Do you think that the Nigeria of today or the Lagos of today, being the commercial nerve of Nigeria, can withstand a lockdown? I know you are not an economist, but let me just put it to you like that.
I understand where you're heading to. Even the government themselves value economy than the people. Why we have this issue we have now is the fear of our economy, if you remember vividly. About 2 months or 3 months ago, we do not have this. We see it as a foreign disease.
Yes.
But today, it's now a local disease. But in early stage, Nigerians fail to believe that it's a general disease. They believe it's a disease of a rich man. But today, we continue to accept it. Yes, we are no longer in a denial stage. But my own aspect is, as far as Lagos is concerned, we need to look at the people before the economy. You must have people before you can talk of economy. People must survive before you can talk of economy. You can revive economy. I don't know whether you believe that. But you cannot revive a dead human being. What economy are we talking about here? I can tell you the governments are the cause of the problems we are having in this country. So to say, I must continue to blame the government. Look at a bank. They allow banks to open, to undergo their normal business, but short durations.
Yes.
Do they ask to close banks, some of their branches? Yes, you can see even in Sululere here, Access Bank, you see that out of 5, only 1 will open. What do you think it will happen for the rest other members who want to use the other branch? They'll have to come to where. Yes.
And social distance is not even there.
It's not there. That is where I said I will continue to blame the government. These are people that government has an authority to call them to orders. So the government has failed to do so. That means the number of the sword the government wants has not yet reached. That's yes. If not, if you call CBN to call these people to order within 24 hours, if you fail to open all the branches, we are going to withdraw your license. All of them will do the right thing. But today, the government has failed in that regard. The government, when you are going towards Oshodi, you are going towards Ikeja along, road construction is going on there. Because the governments are more concerned in the economy than the people. I saw it yesterday while I was driving towards my office. What? By now, we are looking at several isolation centers in general hospital, even at the community level, especially now that we have community transmission.
Yes.
But the government decided to be doing road construction as against investing in human needs. Today, the need of the society is health, survival. Who is talking about good roads? These are roads we've been talking about government about for years ago, that government should come to our aid. But now we have another problem government has started diverging into another problem,
That means
which is of no need.
That means what you are trying to say is that a lockdown is still one of the most preferable solutions.
The lockdown is, I do not advocate for a lockdown.
Okay.
Yes, because the governments are not ready for this surge. Before you advocate for a lockdown, you must see a government political will to help the citizens. Like people who have been indoor, especially people who are on other related, who are on a mania jobs.
Yes.
How many of them government are giving palliatives? The palliatives are just political palliatives. They give it to their political members. There are old women who cannot even walk out to the streets to get their daily earning. They believe, they depend on their sons and daughters to get something to sit back at home. But today, some of those their sons and daughters are no longer going to their daily business because of the government lockdown.
Now,
when the government now placed ban on this lockdown, that everybody should resume back, the government has never give a policy that can work for our country. We have our security details there. By now, a serious government should release their security details. Let them help the society. As far as this street is concerned, now we should have one police stand by here who is watching on whether people use their face mask, is there social distances, all those are not there. There are people who are not educated, and a lot of people, the governments are not looking inwardly to look at those who are not educated. They go to the media and speak medical jargon. It's a medical jargon to some people. Some people do not understand. They should bring to our dialect, our local understanding, so that people can take the necessary measures that can prevent them. I think I can still say the government has a major role to play if we must curtail this particular disease condition. Like some of those organizations I made mention, the bank sectors, so the government should call them to order so that every bank can operate optimally. See market center, they say some markets should be open alternate day.
Yes.
When you say alternate day, everybody will try to converge on that day. If you want things to work effectively and achieve the aim of containing this particular surge, you must allow things to work in a monetary way. So people are rushing to Yahya to get their things. Yesterday, no market. Today, no market. But the market on Monday, everybody wants to be there. What are we going to achieve then? Crowds of what is against the social distance policy.
Now at this junction, we will have to go for a very short break. I have been speaking with Mr. Yahya Itopa Musa, a nurse by profession, a clinician, and a nurse educator. So we really appreciate his coming here. At this junction, we are going to go for a short break. We'll be right back. Welcome back. This is still Facts Hangouts coming from the studios of CRVSR. And with me in the studios is still Mr. Yahya Itopa Musa, a nurse by profession and a clinician. Thank you very much for coming, sir. Now, we've been having a series of conversation surrounding COVID-19. Now, the next question is that the Lagos State still remains the epicenter for the coronavirus disease in Nigeria. Few days ago, the Commissioner of Health, Professor Ikeja, has released a statistics that if we don't try to manage the virus at community level, that we are going to be seeing up to 120,000 cases. Yes, he made a projection. Yeah. About 120,000 cases in Lagos State alone, not nationwide. By July. Yeah. Now, what do you have to say to this?
Yeah. Regards to what he has said, it's a projection, which if what I'm seeing currently here in Lagos continue to persist, we will even have above that projections.
More than 120,000.
Yes, because the current statistics has not give a clear, what's it called, results of what we have in Lagos. We have more than what the current statistics stands for. So as a result of that, any projection the government authorities are giving now cannot stand the taste of what we may likely have in 2 to 3 months to come if this situation persists. The role of corporate organizations has to be played effectively, like bank, if we must curtail this. The government role also has to be played effectively. I made mention of having community policing earlier. I don't know whether you remember.
Yes.
This is the time we need community policing now that people have been clamoring for. The government, each street are supposed to have this community policing, stand by on each street, 1 or 2, just to monitor the activities of the citizen using face masks.
And the transport workers, the regulations.
Transport system, the social distance regulations, even the transport, what's it called? Unions,
yes.
has to play their role for us to achieve or to be able to curtail this. If not, that projection is too small to work we may likely have by July. So I think the government has to sit very well and have or enact a policy that can actually work for the society. In a developed world, they listen to the news. Virtually, most of them are educated, if not 90 to 95. Unlike in Nigeria, where we have, I don't actually have the statistics,
Yes.
but you can't compare our educational level to the like of China, the like of Russia, or the like of US. Like in US, about 44 states has released lockdowns for people to go back to their normal business. Here in Nigeria, you cannot do that and sit back and think you are going to achieve a positive result. The government has to work with the society, knowing who we are, knowing our level of education. Everything variably has to work for us to achieve the desired aims.